Hello, my name is Addie Atwood. I am a Vermont Technical College student. I am in the Associate's Degree Nursing program, and this is my final presentation for my Technical Communications class. Today I will be presenting on air fluidized beds. The agenda for this presentation is to start with the current problem, which is standard hospital beds, the solution to this problem, which is air fluidized beds, the proposed budget, and my conclusion. The first problem with standard hospital beds is the increased rate of pressure ulcer development. It's estimated by the Center of Disease Control that 159,000 nursing home residents currently have pressure ulcers. These pressure ulcers are stage 2 or greater. That's 11% of nursing home patients. Pressure ulcers are also known as bed sores, and they develop as a direct result of pressure upon the skin. There's 4 ways in which pressure ulcers are developed. This is through friction, shear, heat, and moisture. If a patient develops a pressure ulcer, it leads to increased length of hospitalization, which is the second problem with the current standard hospital beds. If a patient develops a pressure ulcer, it's estimated that the length of their stay will increase by 4 to 10 days. Along with the length of stay, another problem with current standard hospital beds is a decreased quality of life for the patients who develop these pressure ulcers. Pressure ulcers are extremely painful, and the treatment of pressure ulcers are extremely painful. The treatment includes repositioning, rebandaging and wound care, debridement, and all of these things cause the patient an immense amount of pain. This can cause the patient who suffers from pressure ulcers to be socially withdrawn and isolate themselves as well. Another problem with current standard hospital beds and the development of pressure ulcers that arises from these beds is an increased cost to the healthcare facility. Wilma Wheeler, an RN, stated, "Pressure ulcers are costly in several resources, including supplies, supportive surfaces, and nutritional supplements. They often result in survey citations affecting the quality measure and 5-star rating, which can negatively influence the public's perception of a facility and its staff. This can have an impact on the hospital referrals and the facility's ability to maintain census." If the public has a negative view of the hospital, they're going to go out of their way to avoid that hospital. If they need treatment, they're not going to go to that facility. This will in turn affect the cost that the finances that the hospital brings in. Also, the treatment of a pressure ulcer is estimated to cost $2,000 to $20,000. The problem with this is that a hospital-acquired pressure ulcer won't be covered by that patient's insurance company, which means the hospital is going to have to pay for all of the treatment and the extended stay. This means for every pressure ulcer that develops, the hospital is paying somewhere between $2,000 and $20,000. Another problem is that when a pressure ulcer is acquired during the hospitalization of another admitting diagnosis, that patient has a lawsuit in their hands. Now, it's estimated that a lawsuit settled for a pressure ulcer can cost anywhere from $250,000 to an upwards of over $300 million. Now, the solution to this problem is air fluidized beds. Air fluidized beds work by circulating beads throughout the mattress to take the pressure off of any one site at a time. The pressure is going to be equally distributed throughout the mattress. The mattress also supplies heat and comfort to the patient. It supports skin integrity and improves patient comfort. It makes patient positioning easier and faster, and it accommodates patients who have other underlying issues such as respiratory complications. The budget for this project starts with the 25 air fluidized beds. Each air fluidized beds costs a little more than $42,000. This brings the vendor cost to $1,066,000. That seems like a large amount, but when you think of the savings on lawsuits and the savings on the cost of the healthcare facility that the insurance company won't cover through hospital-acquired pressure ulcers, over time the hospital is going to be saving an immense amount of money, and this cost is going to be easily made up in a short amount of time. The project manager will need a budget of $25,000 to oversee the project and over the 6-month period that the project will be implemented. The staff is going to need certification to train the other staff members. This is a cost of $2,000. The time and training of the other staff members is going to cost $5,000 and an indirect rate of $10,000. This brings the total budget to $1,108,000. In conclusion, by implementing and installing air fluidized beds, the rate of pressure ulcers is going to be decreased, the length of hospitalization of patients will decrease, patient satisfaction will increase, and the cost to the healthcare facility will decrease. I know that implementing and installing air fluidized beds is an expensive and intimidating task, but I look forward to working with you and getting this task accomplished in the most effective way possible. Thank you for your time.